Good afternoon, everyone. Thank you for watching our live briefing for Thursday, May 28th. Today, I'll have some information for you about our next steps. Then Deborah Jacobson will provide some information about the services that are starting up next week. And lastly, Chaplain Logan Augustine will introduce our Thoughtful Thursday speaker. In the past couple of weeks, we've shared steps 1 and 2 of our Westminster Canterbury Richmond Next Steps plan. Today I'll be sharing the outline for steps 3 and steps 4. I'd like to remind you all that these next steps are planned and intended to be a series of deliberate incremental steps that restart our operations, re-engage you with each other, and then re-engage you with the broader community before we open up our community fully. Each level of care at Westminster Canterbury Richmond, independent living, assisted living, memory support, Parsons Health Center, requires its own specific processes, and there is a level of nuance as to how these procedures get applied across those different levels of care across campus based on the risks and the level of vulnerability of our different resident groups. Step 1 started this week, and as I know many of you took advantage of the salon services or got back into the art studio or wood shop. Step 2 starts next Monday on June 1st with a number of programs and services around campus that will be restarting with a number of new processes and new restrictions in those areas as they reopen to ensure that everyone's safety is maintained. Starting next Monday, the following different areas will restart. The Gables salon area will reopen with limited hours, same process as what's happened in Main Street Salon and Avalon. Gables Salon will open. Our outpatient therapy program will restart. And the therapy team will have limited numbers. I think 4 patients at a time will be seen. I think I skipped something. I'll come back to it. Our fitness and aquatics areas reopen by appointment only next week. Deborah Jacobson will speak to you a little bit about that. Couples at Westminster Canterbury where one spouse lives in independent living and the other spouse lives in assisted living. We have a number of those. We'll have visitation protocols so that those husbands and wives can get together and spend time together. We're going to be restarting our supportive therapies like horticulture, music, and art, mostly in our assisted living areas starting next week. The Marketplace Billiards Room will reopen, and we'll have enhanced cleaning protocols and guidance on how to use that room. We're asking that the room be limited to 2 individuals at a time. As Jessica told you earlier this week, on Tuesday, starting June 2nd, we will have outdoor music called Tunes on Tuesday, and that'll be out on the Ellipse, and so look forward to that. You'll hear more about that tomorrow. Starting next week, pastoral care and recreation will resume some small groups, limited to 6. Those still take place in the lounges around campus. Also next week, pastoral care will resume visitation in both assisted living and Parsons Health Center. Dry cleaning service deliveries from the different dry cleaning services will restart next week, and Sherry Grady will be here tomorrow to give you some of the details about that. And then the mobile dog groomer is also going to be on campus starting next week. As I already said, Deborah Jacobson will follow me today and share details about how you can get yourself scheduled for some of these activities. And then tomorrow, Beth Travis, who's our rehab director, will be here to talk to you about restarting the rehab program. And Sherry will be here to talk about the dry cleaning procedures. Before I share with you the steps 3 and steps 4, I do want to take a second and remind everyone that as an organization and as a community, moving forward is our plan, but we are subject as a group to the reality that the coronavirus really dictates our future as much as our planning does. We are moving forward into steps 3 and 4, assuming that we maintain the level of control over the virus that we have for the last period of weeks. But I just need to say the coronavirus really does dictate how we go about this. And so we're moving ahead. If the situation changes and we have new resident cases, we will most definitely need to modify our plans accordingly. But we're going to do everything we can to avoid that. Now, let me share with you step 3, which begins Monday, June 8th. Before I get into the details, I do want to say, though, we still have a lot of the details to figure out relative to steps 3 and steps 4. And today, what I want to share with you is an outline. We won't have all the details flushed out completely until next week. So I'd ask you to please hold your questions and the calls until next week when we have an opportunity to share with you those details and the written plan, because otherwise, making a lot of phone calls, asking questions today isn't going to be, we're not going to have all the answers you're looking for yet. But the details are to come. Step 3 outline, starting Monday, June 8th, independent living residents will be able to leave campus for essential personal business and medical appointments. When you return, we're going to take your temperature at the gatehouse, and we're going to keep a log of residents as they come back onto campus. The log is really for contact tracing purposes. In case we have a new outbreak, we need to know who's been out of the campus and when, and keeping that log for the Virginia Department of Health will be very important. The question's already been asked, and it'll get asked repeatedly. What is essential personal business? That's for you to decide as a resident. If you must do it, then it's essential. You're safer here. We want you to understand that. You're safer on campus, and you're safest in your apartment on campus. As you go out to do personal business, we just ask that you take all the necessary precautions and limit it to those things that you must do, like personal business and medical appointments. The second thing that's going to start on June 8th is that our transportation department will begin offering transportation services for a fee for residents that don't drive to go out and do essential personal business and medical appointments. Also starting June 8th, the Galleria will reopen in the center with restrictions and limited hours. So that's what happens on June 8th. Starting on June 15th, we begin step 4. Step 4 is even, we have a lot more work to do around the details for step 4. But step 4, independent living and assisted living areas, we plan to have visitation on campus in a structured, scheduled, safe way for family members. As I said, this is still in the planning phase, and we're not prepared yet to discuss the details. So it's really not worth calling and asking a bunch of questions, because we still have a lot of work to do to figure out exactly how, where, when, what the rules will be, and what the schedule will be like. For Parsons Health Center, we are also planning to be ready on June 15th to allow for structured, scheduled, safe visitation with family members. Now, the caveat to that is the Centers for Medicare and Medicaid Services, what we call CMS, has a prohibition on that at this point. So today, it's not allowed. And we don't know exactly when that restriction is going to be lifted, but our intention is to be ready with a space and a program and procedures so that as soon as CMS allows it, we're prepared to do it. And our hope is that by June 15th, we'll have clarity on when exactly we can start and get it scheduled so that families know when they can come. So more to come on all that. That's a lot of information. Also, June 15th, our plan is that the wood shop and the art studio will have more hours and that they'll become available for residents in assisted living as well. The last thing about June 15th is our intention is to have massage restart as well in an alternate location than where it's been. Our massage room has been in the rehab area, but we're going to keep rehab for just rehab, and we're creating a new location for the massage therapist. So steps 1 through 4, that gets us through June 15th, gets many of the programs and services restarted and begins to allow residents to move freely, to more freely interact with each other and with the broader community and with family. Steps 5 and step 6, which today I'm not prepared to put a date on because the state's restrictions don't allow them, will include restarting our dining programs. I realize I've shared a lot of information with you in a very short period of time. Next week, we will be providing you with more information and the details around steps 3 and steps 4 during our live briefings all next week, and we'll provide the details in writing, much like we did in steps 1 and 2. Next week, we will also spend time talking to you about how you as residents can keep yourself safe when your friends and your neighbors begin to go out into the greater Richmond area and come back onto this campus. You will need to be extra diligent about your social distancing and wearing a mask to remain safe from the coronavirus. I just got to say, as a resident body and as a community of friends, you have all done a fabulous job from the beginning of staying away from staff. And I've said more times than I can remember, you need to be afraid of us because we're out in the community and we're exposed to the coronavirus and we're coming back. And as residents, you've done a phenomenal job of keeping your distance. And because of that, you've all stayed well. We've had 2 cases and that's it. And that's a wonderful thing. And you deserve all the credit for that. I want to say thank you to you for your efforts. We definitely see a lot of you wearing masks, and we see most all of you complying with these new social distancing guidelines. They are very important because they're really our best defense against getting this horrible virus. So thank you for that, and thank you for what you're doing, and thank you for continuing to be diligent about these new and strange rules that we have to live under for a while. I'll be back tomorrow with more information, and now I'm going to turn it over to Deborah Jacobson, who can give you some of the details about fitness and aquatics.
Good afternoon. I want to give you a little bit more detail about some of the services that will be opening up for you next week. I know John just told you about several things that will come the 8th and the 15th. These are the things that are coming to you on June the 1st. The Fitness and Aquatic Center will be open. The appointments are needed at this point so we can have the social distancing that's needed and all of the cleaning that we need after you use the equipment. You do need to make an appointment, and we have only a few appointments left for this week, for the coming week. You can call 6539 for the pool and 6669 for fitness. Once you secure your appointment, you will receive necessary paperwork to fill out prior to your appointment, and please refer to the tails to get all the details. But most importantly, make your appointment, have the staff put the information you need in your boxes, fill it out, get it back to you to the fitness center, and all should go well on Monday. Main Street Salon, Barbershop, and Avalon Salons have been really busy this week. But starting on Monday, June 1st, as John mentioned, the Gables Salon will open and serve those residents that are in the Gables and Monticello. Also, the Pavilion residents will begin to be served in the Avalon Salon. Opening the additional salons will allow us to service more residents and allow for social distancing. Though at this time our services are limited, We are hopeful as we spread out all of our salon service workers that we will be able to add additional services in the near future. Updates can be found in the upcoming Tales. Call 6281 for an appointment in any of the salons. Starting next week, the Tales will be available on Thursday, as it was in the past. The Tales will be delivered to the Tower Information Center or to the Center Business Center to be picked up by the residents as it was prior to the COVID-19. John mentioned the mobile dog grooming. If, in fact, that is something you're interested in, that will start June the 1st with appointments. Please contact Resident Services and we'll work you through that process. Lastly, I would like to say thank you to all the residents who have returned to work. We appreciate you filling out the necessary paperwork. We appreciate you following all the screening processes. If for some reason you haven't signed up and you're going back to work over the next week, we ask you to contact Resident Services at 6082, and we will make sure you get the paperwork and all the processes will be explained to you. Again, thank you for everything that you're doing to keep our community safe. At this time, I'd like to turn it over to Logan.
Good afternoon. I'm Logan Augustine, one of the chaplains here at Westminster Canterbury. Thank you for joining us for Thoughtful Thursday. We are really enjoying inviting our resident clergy to join us for Thursday updates to share a thoughtful reflection with all of us. So today we welcome Reverend Dr. Rebecca Weaver. Rebecca is, of course, a resident here at Westminster Canterbury and Professor Emerita of Church History at Union Presbyterian Seminary. So we welcome Rebecca today.
The author, Anne Lamott, has characterized all of our prayers as falling into one of two types. Help me, help me, help me. Or, thank you, thank you, thank you. That characterization may seem too flippant, but Lamott is onto something, I think. For sometimes when we try to pray, words fail us. And all we can come up with is, my God, help me, help me. Or, dear Lord, thank you, thank you. I'm convinced that those two expressions are surely sufficient for God. It is we who need more. On those difficult occasions when words fail me, it is the ancient language of worship that comes to my aid. And those familiar words and phrases that have come down through the centuries assure me that I am not alone, but I'm joined in my prayers by all who have ever prayed those words. The whole communion of saints is praying with me, with all of us. The basic prayer for Christians is, of course, the Lord's Prayer. God's gift of words to be given back to God. Normally, we simply say this prayer without any pause. But these same words can be used to express our particular concern for someone or something. For example, Our Father, who art in heaven, for Mary. Hallowed be thy name, for Mary. Thy kingdom come, for Mary. Thy will be done, for Mary. Or we might use those same words to pray for something. Thy kingdom come, for this planet Earth. Thy will be done for this planet Earth. Sometimes, however, we can only bow our heads and say again and again, thy will be done. Thy will be done. Or we may use some other cry from the liturgy. Lord, have mercy. Christ, have mercy. Lord, have mercy upon us. At other times, we may find no idea of what we even need to pray for. This was especially true for me as my parents neared the end of their lives. I sat at the bedside first of my father, and then several years later, the bedside of my mother, and said again and again 2 lines that are given to us in the Psalms. Make haste, O Lord, to deliver us. Make speed, O God, to help us. Make haste, O God, to deliver Daddy. Make speed, O Lord, to help him. Make haste, O God, to deliver Mother. Make speed, O Lord, to help her. In these difficult days we are going through now, when there are so many people and conditions to pray for, I find it helpful to use a prayer that is in both the Episcopal Book of Common Prayer and the Presbyterian Book of Common Worship. So let's try using these words as we pray. Keep watch, dear Lord, for those who work or watch or weep this night, and give your angels charge over those who sleep. Tend the sick, Lord Christ. Give rest to the weary. Bless the dying. Soothe the suffering. Pity the afflicted. Shield the joyous, and all for your love's sake. Amen. And at all times when we pray, let us be assured by the words of the Apostle Paul in Romans 8. The Spirit helps us in our weakness, for we do not know how to pray as we ought, but that very Spirit intervenes for us with sighs too deep for words. Thanks be to God. Thank you for joining us this afternoon for the update. The next one will be tomorrow, Friday at 3 p.m.